Hello and welcome to Noble Mind.
The Noble Mind podcast is brought to you by the Institute for Meditation and Psychotherapy. Hello, I'm Alex Gugjo.
And I'm Dr. Kate King. In this episode, Dr. Lindsey Jacobs shares 6 key principles of acceptance and commitment therapy to help us live according to our values, practice acceptance, make contact with the present moment, and more. Dr. Jacobs is a licensed clinical psychologist who specializes in geropsychology. Her clinical interests include delivering evidence-based individual and group interventions to older adults and their caregivers, conducting decision-making and functional capacity evaluations, and working in interdisciplinary teams. She's also the host of the Geropsychology podcast.
Please note there are a few seconds of glitchy audio. You may not notice it, but if you do, know that it's part of the recording and not on your end. You can get this episode's show notes, a copy of the hexaflex diagram Lindsey discusses, and share your responses and suggestions at noblemindpodcast.com. We hope you enjoy the show.
Thanks for inviting me to be on this podcast. I'm really excited about it. Mindfulness is a topic and a practice that I'm really passionate about. So I'm happy to be here. So I am a clinical geropsychologist by training. And what that is a psychologist who specializes in working with older adults. I did my graduate training at the University of Alabama, and in graduate school, I actually started specializing in working with older adults, and I did a clinical internship at the Memphis VA Medical Center, and I did a postdoctoral fellowship at the Salem VA Medical Center, and I've worked in a number of different clinical settings and working with older adults, outpatient mental health clinics, inpatient medical settings, nursing homes, hospice, inpatient psychiatric units, working with older adults. And I would have to say that it was probably toward the end of graduate school and definitely getting into my internship that I started using mindfulness in my clinical practice. Right now, I am a clinical psychologist in a geriatric mental health outpatient setting, and I train clinical psychology interns and postdoctoral fellows and psychiatry residents in using mindfulness and other forms of therapies in an outpatient mental health setting with older adults. And I use mindfulness a good bit in my clinical practice. And a little bit of background in how I got into mindfulness practice. It feels like a long time ago. Before I even entered graduate school for clinical psychology, I actually got a certification in group fitness and health and got my AFA certification, that stands for Athletics and Fitness Association of America, and a yoga and Pilates certification through Fit Tour. And I started teaching wellness classes at a community college. And in my yoga classes, I would always end with some sort of mindfulness or meditative practice. And as part of the wellness programs, I also taught about mindfulness and meditation. And so I was really excited when I got into clinical psychology, realizing that psychologists also use this as a therapeutic tool. That's a little bit about my background and how I got interested in mindfulness.
That is really funny, Lindsey, because I was actually a yoga teacher and taught yoga and meditation before I became a clinical psychologist as well.
And it's funny, when I started teaching yoga and was introduced to mindfulness and meditation, I don't think I really had a full appreciation of the practice. And so it's really been a learning experience over the years. And of course, there's still much more to learn because you're never excellent at meditation and you're never excellent at mindfulness. It's more of a process, right? And so I feel like I'm continuing to learn.
Could you tell us a little bit about how you started to learn about ACT and developed this special interest?
So in graduate school, I was primarily trained in cognitive behavioral therapy. And in cognitive behavioral therapy, the focus is on challenging unhelpful or maladaptive thoughts and behaviors to improve emotion regulation. And it really wasn't until toward the end of my graduate training that I learned about acceptance and commitment therapy, or ACT. And when I entered internship is when I actually really started delving into the literature on ACT and the clinical practice of ACT. So acceptance and commitment therapy, the focus is on being present, opening up to the present moment, and doing what matters to you. So the goal of ACT is to increase one's psychological flexibility. And ACT is what we call transdiagnostic therapy, in that it is useful for pretty much anything that is causing suffering, something that someone is struggling with. And ACT, there's a framework for ACT. It's called the hexaflex. And there's 6 points on this hexaflex. And the 6 points are acceptance, diffusion, self as context, present moment awareness, values, and commitment or committed action. I'm happy to go through those points on the hexaflex. So starting with acceptance is aimed at accepting someone's internal experiences, your internal experiences. And what these are is thoughts and feelings. So acceptance is sort of the opposite of avoidance. So when in life, when we are struggling with our internal experiences, we naturally try to avoid or push away any uncomfortable thoughts or feelings. And first of all, it's difficult to sustain. We can't push away unpleasant thoughts and feelings 100% of the time. And trying to push away or avoid those unhelpful thoughts or feelings can actually get in the way of us living a life that's important to us. And so with acceptance, we're focusing on just letting those internal experiences be. So when you have an unpleasant or uncomfortable thought, rather than trying to push it away, you just notice it and let it be there.
I have to stop you on that point right there, because that's something that I think a lot of people really have a hard time with, when they're told to just notice or just be with a thought. I think that's really hard for a lot of people. So how do you work with that?
Oh my gosh, absolutely. This is one that I feel like we struggle with the most, that I see clients struggle with the most. And when I bring this idea up, this idea of acceptance, sometimes people will naturally push against that. So something that I hear a lot is, so you just expect me to lie down and let this be? They see it as sort of as defeat, basically. And so I think using the term willingness can actually be beneficial when you're working with clients. So willingness is really getting at the same thing. So being willing to let those internal experiences be. So the idea is that everyone in this world, we're not immune to experiencing difficult situations. It's how we respond in those situations that can create suffering. And at ACT, what we're doing is focusing on those reactions. So for example, if you have a client who has lost a child and is really struggling with that, we wouldn't be promoting the acceptance of the loss. We would be looking at the thoughts and feelings that come up with that. So a client might have a thought like, there's no purpose for me in life anymore, or there's something that I could have done to prevent this. And it's those thoughts that create that additional suffering. And those are the things that we target.
That's very helpful.
Yeah. So in therapy, I do use the term acceptance, but I think more often I use the term willingness, because willingness really gets at this idea of what we're talking about, this willingness to just allow those thoughts and those feelings to be. In that example of losing a child, some ways that a person might respond could be using substances to try and drown out the difficult thoughts and feelings that come up. And so we are promoting willingness to let those thoughts and feelings be rather than trying to avoid them with alcohol.
Yeah, I think that willingness is a much more helpful and useful word for a lot of people. I feel like it doesn't have the same loaded quality that acceptance has, which I think for a lot of people can sound like sit there and take it. Just like, sit down and shut up kind of a thing.
Right, absolutely.
Right. Whereas willingness is sort of saying, well, being okay with having an experience or being willing to endure something or feels, I don't know, it feels less loaded and more useful.
So willingness to, how would you fill that in? Willingness to do what?
Willingness to let yourself feel. Willingness to let your mind work. Because we know that the mind is going to create thoughts upon thoughts upon thoughts. And those thoughts are going to impact how we feel in the moment. And trying to push it away can cause more suffering.
So a willingness to feel sadness, or a willingness to feel anger, or a willingness to have the thought, I could have done something to prevent this,
Yeah.
or whatever the case may be.
Yes,
right?
absolutely.
To experience that thought in your mind instead of trying to drown it out, like you're saying, with alcohol or, some other escape method.
And this really goes into the next point on the hexaflex, which is diffusion. So diffusion is the opposite of cognitive fusion. And cognitive fusion is a term to describe buying into thoughts, believing that our thoughts are real or reality, believing that our thoughts are the be-all and the end-all. So with diffusion, what we're doing is helping clients just simply observe those thoughts as they are, just simply thoughts, without buying into them. Similar to what you were saying, Kate, seeing those thoughts for what they are. So with a parent who's lost a child, rather than buying into that thought that life is not worth living, being able to notice, oh, my mind is telling me that life is not worth living. And I think this diffusion is really where you start to get into realizing that you have a choice to believe in that thought or not believe in that thought, or act accordingly, react to that thought or not react to that thought.
So recognizing that when you have a thought, you realize it's a thought. It's not an accurate description of what's happening right now.
Right. So ACT is what we call a third wave behavioral therapy. So CBT is sort of its cousin. In CBT, what we're doing is looking at maladaptive thoughts or cognitive distortions. Just the wording of those terms makes it sound like there's something wrong with what you're thinking. But in ACT, what we're saying is there's nothing wrong with what you're thinking. Your mind is going to create thoughts, and that's okay. That's what minds do. They generate thoughts, but you can choose to react to those thoughts or not react to those thoughts.
Yeah, and I think that diffusion is like in Buddhism or in other traditions too, where people talk about the witness consciousness, like being able to step back and observe your thinking or witness your thinking. Mm-hmm. Or like when you're meditating and people tell you to watch your thoughts, that's basically diffusion, right?
Yeah, absolutely.
Yeah. So I think that's I've found that term to be very helpful, both in terms of, when I'm teaching meditation, to have that word or a description of that as another way of describing that way of witnessing, so in psychotherapy with clients, and thinking about things that are fused together, like someone who's a welder might have two pieces of metal that they're fusing together. And then defusing those two things. So fusing your thoughts or defusing your thoughts from your experience.
Right.
So you can observe them and get some space between yourself and what you're thinking.
Yeah, absolutely.
Yeah. So creating that gap there where you can step back and see what you're thinking rather than just be your thoughts, which it can feel like some days.
Right. And when working with clients, to really highlight what diffusion is, it can be really useful to use what's called the two computers metaphor. What I do with clients is, with my wonderful artistic abilities, not quite so, I will draw two pictures, one of a stick figure that's sitting in a computer, and the stick figure is so close to the computer that that's all the stick person can see. So that's all that is in the person's visual field. And then the second picture that I draw is a stick figure that's sitting at a computer and watching a computer screen, but this time there is a gap between the stick figure and the computer screen, much like that gap that you were talking about, Kate, earlier with diffusion. And so the idea behind this is that the stick figure that has the computer screen close to his or her face, that's all that person sees. So if you can imagine, thoughts running across that computer screen or feelings running across that computer screen, that's all consuming. That's all that person is aware of. But that stick figure that's sitting a little bit of distance from the computer screen, they see the thoughts, they can see the feelings that come up on the computer screen, but they also see other things in the environment. They can see around them. So there's that distance there.
Yes, that's very helpful. It may also be helpful to point out to listeners that we're talking about diffusion. So you're no longer fused, as opposed to diffusion, making things diffuse.
Oh, DIFFUSION.
Oh, yeah.
We are talking about DEFUSION.
That's correct.
Yes. Right. To get unfused. Right. Not to diffuse yourself.
Right.
Yes.
Right. No, that's helpful. Right. Yeah.
Absolutely.
Right. Yeah. And creating that space is so important. And again, it just reminds me so much of meditation, that you can feel so much like you're just swimming in a sea of your thoughts. But then at some point you get some distance, like you're saying, you step back from, in the computer metaphor, you step back from the screen and you can see everything around the screen and everything in the room.
Right. Absolutely. And another thing that I have found to be useful is language is so important, and it really impacts how we view the world. And so if I've got a client in front of me that is saying things like, I'm a depressed person, that things are not going to get any better, I actually have the person practice saying, I'm having the thought that life is not going to get better, or I'm having the feeling of sadness right now. And I have them practice that over and over again. Just invite them to, when they're out of the therapy room, to practice that on a daily basis and see what comes up for them. And what I have found is that just practicing that, changing the language just a little bit to get a little bit of space between there so that the thoughts and the beliefs don't define them in that moment, that can be really useful.
Yeah, that's great. I remember encountering somewhere in some ACT materials, even just adding more language to the front of it. So like what you're saying, I'm having the thought that, I don't know, life is not worth living could become, it seems as though I'm having the thought that life is not worth living.
Yeah.
And, the more layers of like language you put ahead of it, the more distance sometimes you're able to create from it.
Yeah, absolutely. So in ACT, we do exercises and we also use metaphors to emphasize these points. And there's this funny, silly, but really useful sometimes exercise that is called lemon, 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 or milk, milk, milk. These two exercises really highlight the purpose of language and really emphasizes that all language is just letters put together to form words. So I'll have them visualize a lemon and really take a few moments to think about what a lemon tastes like, to think about how a lemon smells, and to really invite them to experience those sensations that a lemon can bring or can cause in that moment, so that they really have that experience in their mind. And then I have them say lemon as fast as they can over and over and over again for, it really only takes 15 seconds. Sometimes I'll do 30 seconds. You can practice this. You can practice this on your own if you'd like. What happens is it becomes garbled. It becomes no longer a word. They're no longer envisioning that lemon. They can no longer sense the smell or the taste of the lemon. And this is a technique that they can use with any other word that represents something that they might be struggling with.
Yeah, that's great. It is making me think of names. You know, some people have a really hard time remembering names, but they remember the person very well. And so your lived experience of a person, you know, can feel very alive. Like as you were describing the smell and the taste of a lemon, like it becomes very vivid and you can feel it in your senses. You know, you can smell it, you can taste it, you can see it. And it's very vivid and alive and on some level. And then you get the lemon and it's like, well, that's just a weird word, you know, or like somebody's name, like Lindsey. Like, what does Lindsey have to do with Lindsey? It's just a word.
Right.
It's like a random thing. So no wonder names are hard to remember. You know, they don't have meaning, you know, but the person, you can remember the person, what they said to you last time they were together, how you feel when you're around them, all that kind of stuff.
Right.
So, yeah. And I have personally had the experience sometimes in life where you just hear a word and it just sounds weird. Like you're able to get some distance from it, you know, and you're like, potato, what a weird word, potato, or milk, and it just suddenly feels like completely absurd.
Yes.
Maybe that's me, but yeah, so I think that some of those ACT exercises are trying to get at that, you know, the sort of arbitrary or abstract quality of language and how they're kind of a poor substitute for the experience of life.
Mm-hmm. Absolutely.
And then reminding you that language is what you talk to yourself in your head with all the time.
Yeah.
And that's a very different experience from actually living your life.
Right.
And I think if I remember correctly, Stephen Hayes, who's the creator of acceptance and commitment therapy, has a background in linguistics or something, doesn't he?
Yeah.
So
connects to relational frame theory, I think. So,
absolutely.
Yeah.
And then the third point on the hexaflex is known as self as context. And this is the opposite of self as concept or self as content. In self as concept or self as content, this is where the person feels defined by his or her internal experiences. And self as context is known as the observer self. So this is recognizing that you're more than your experiences, that there is a you there that is unchanged by your internal experiences. There is a you there that is there all the time, and that these internal experiences are really like the weathers of spring and fall and summer.
Yeah, I think that one can be tricky especially for people who aren't used to thinking in this way, maybe. Like if you've made psychology your life study or mindfulness or meditation or you're Buddhist or, you know, these certain approaches to the world make it easier to relate to this sort of idea. But I think for a lot of people that this one sounds like it would be pretty tricky to describe.
Absolutely. I think, you know, as a clinician, this was the point on the hexaflex that I struggled with the most at the beginning, and understanding and figuring out how to share with clients. You know, a lot of different types of therapies, what we do is try and share our knowledge and teach a new skill. And self as context is a very abstract concept. And one of the things that I've found the most helpful in ACT is refraining from trying to explain. And instead, we use the exercises and the metaphors to try and help the person experience what we're talking about. So an exercise that I like to use for self as context is what's called a mountain meditation. And you have the person envision oneself as being a mountain. So you describe the characteristics of a mountain, and then you describe feeling the experience of different types of weathers being the mountain. So experiencing one being a mountain while there's crashing rain and wind, experiencing being the mountain while there's a blizzard or a snowstorm, experience being the mountain when there's hot sun beating down on you, and realizing that the mountain is always there. The mountain is unmoving and unchanged by these different weathers that come along. And the weathers represent our internal experiences, the things that we think, the things that we feel, and the mountain is the you, the observer you that is always there. So I think sometimes it can be useful in ACT when we're doing a mindfulness exercise, somewhere in the exercise, bringing their attention to the observer self, the person that is observing all of this going on inside them.
That's really beautiful, actually. My experience is I have come across this teaching in Buddhist contexts, but I'm impressed with the term that's attached to it, the self as context, which really captures it very well, because so many people feel defined by the content of their, like, I'm the kind of person who has this kind of difficulty, as opposed to what you're describing.
Yeah. Another way that it has been described, Russ Harris actually has a really nice audio file that he has available on the internet that describes the observer self. The way that he pitches this is envisioning that there is a stage and there's an actor on the stage, and there's all the things happening on the stage. Lots of different things can happen on a stage, and that the observer you is actually the stage. It's not everything that's happening on the stage. Things are going to move on the stage, props and actors and lights and everything. And the observer you is actually the stage where everything is happening on. There's also a chessboard metaphor. So you envisioning having a chessboard game occurring and the different chess pieces, and that the observer you is actually the board where all of these pieces are moving and taking place. You are the board. You remain the same throughout.
That's super helpful. It's reminding me also of, I think it maybe comes from DBT, dialectical behavior therapy, which is another third wave. They talk about distress tolerance. And I think it's from them that they have a tea kettle metaphor where you are the tea kettle as the water boils inside or splashes around, and all these things happen within the tea kettle, but you're sort of the container, or you're sort of the space in which those things happen. And
I like that.
Having to handle all the ebbs and flows of emotion. So that sounds like another self as context metaphor. And I love how all of these, like you're saying, it's not just explaining, but it's more about using metaphors and things to imagine to really induce like a lived experience of these ideas. So it's not just about understanding them intellectually, but more about kind of helping to create a situation where a person can really feel and experience these.
I like that a lot. There's also this really great mindfulness or meditative practice in ACT to highlight this self as context. And you have the person sort of go back in time, recognizing, what they might have looked like as a little baby, thinking about, just how small you were, the skin that you were in at that time, and thinking about how you have grown over time, all of the experiences and challenges and losses and suffering that you've experienced. And all the while, there is a you there that has always been present. And it's that you that is the observer self.
So ACT offers the rich treasure house of metaphors, which you can use as a therapist to point the client toward their experiencing. Is that accurate?
Yes, absolutely. And I have to say that there's so many different metaphors and exercises. Not all are going to work with every client. There are some that resonate more with others. And so it's really a trial and error process. And I appreciate that there are so many different metaphors and exercises, and having a good knowledge base of those can help with developing your own exercises and metaphors as a therapist. But it's really useful because, going back to something that I said earlier, in ACT, we're not trying to explain to the person or tell them how to think and how to feel, but we're really there to facilitate the process of being open to experiencing it in the therapy session.
I just love that about ACT. And I think just this idea that, using these metaphors and examples and really kind of putting the person in their own imagination with some of them, that it can really create an experiential understanding of these things rather than just an intellectual kind of exercise.
And one point on the hexaflex, which I think is present in all of the other points of the hexaflex, is this present moment awareness. And the opposite of present moment awareness is this dominance of the past and the future. So we've been talking about the mind and the internal experiences, so those thoughts and feelings that you experience. In ACT, we talk about how our minds are constantly generating thoughts, and the majority of them are focused on thinking about the past or worrying or planning for the future, and that often we are not in contact with the present moment. And so we practice present moment awareness. And I think mindfulness really dominates in ACT. So in mindfulness, what we're doing is helping the client make contact with the present moment through the senses. So having them open up to noticing what they hear, noticing what they feel, noticing what they smell, noticing what they taste. So the mindful raisin eating exercise is one that we use in ACT. And I think a lot of clinicians probably start off with that exercise and mindful breathing.
That's great. And I think I would love to see people mindfully eating other things besides raisins, because it seems like that's always the chosen food for some reason. I don't know. Maybe we could start a movement to mindfully eat grapes or something, at least.
You know what? I think it could be useful to mindfully eat something that's sour or bitter, because I think that can help get back to the point of acceptance or willingness, a willingness to open up to the experience of bitterness or sourness and just feel what that's like.
Right. Mindfully eating things that are not your favorite foods maybe would be a potential practice, an exposure kind of practice. So I think we've covered 4 of the hexaflex items so far. Is that right? I've got
that
acceptance or willingness. I have diffusion, self as context, present moment awareness. And so I think there's 2 more. Do you want to let us in on what those are?
Yeah. So values is the next one. And the opposite of that is having a lack of clarity or lack of contact with values in general, just having a lack of direction in life. So the purpose of knowing one's values is knowing what's important to you, understanding the kind of person that you want to be. And so in ACT, what we're doing is having the person start to open up to experiences, be present in the moment, in addition to getting some clarity on what's important to them and helping them move in the direction of living a life that is meaningful, living a life that is purposeful. And there's a number of different values exercises. There's something called the values card sort, where you have values written on cards and you have them sort out values that resonate the most with them. So for example, you might have a value of being kind, and you can be kind in different areas of your life. You can act out that value of being kind in your relationships, in your work life. And I think a lot of people tend to get stuck on goals. They think that there's this misconception that goals are values, and they're very different. So I think it's useful to have goals in life, but goals are something that you can complete. And when you complete them, you're done. It's like going to graduate school, check, I did that. Becoming a clinical psychologist, check, I did that. Values are something that you can never stop doing. There's always more to work on with values.
So in that example, maybe the underlying values would be a value of personal growth or lifelong learning or something like that. That would be undergirding your pursuit of education, but which would continue even after you get your degree.
Right, absolutely.
I'm thinking of another example, maybe a person who has the goal of having children or something like that, versus maybe the underlying value of family or connectedness. Or something like that, which is, again, something that would inform all of your actions rather than just, again, sort of like a checkbox. Check, I had the kids.
Right. Absolutely. And then the final point on the Hexaflex is commitment or committed action. And this is the opposite of inaction or impulsivity or avoidance. And so it's nice to be present, to open up to experiences, and to have a sense of direction in one's life. But this committed action is so important because without that, you're really stuck. You're not going anywhere. And so the committed action piece really fosters clients in taking action to pursue those important things in life. And really, you have to use all of those other things that you've learned through the different points of the Hexaflex to get you to the point of committed action.
That sounds like a not so easy piece of the puzzle to get people to take action on things they care about. Is that your experience? Must be tricky. Like, you don't want to pressure people to take action.
Right. I think that's why acceptance or willingness and diffusion, why that becomes so important when you get to this step of committed action. And working on committed action, you're really fostering this idea that you have a choice. You have a choice on how to react. You have a choice in your life how you want to move your life forward. And usually you have done a good bit of work on the front end before getting to this committed action piece. And then this is a part where you spend a good deal of time working. And ACT generally is like a 16 session therapy. And we hope that our clients will continue to work on this committed action piece once they're out of therapy. It's really just using those metaphors and, more importantly, I feel like the experiential exercises in the session to get them to open up and try an action to move forward and do something that's important.
Say if the client is having difficulty with assertiveness, you would use the other 5 points of the Hexaflex to get them to relate differently, to have different experiences. Is that what you mean?
Yeah, absolutely. Especially willingness is something that I tend to go back to a lot with clients, because often what happens if we're not doing something that we think might be important to us, we're not doing it because we're afraid of it or because of something that's coming up in our internal experience, is a thought that we might fail, for example, or a thought that we might be rejected. And so that willingness is so important to help them recognize those thoughts, those emotions, and decide whether or not they want to buy into them, getting back to that diffusion piece, whether or not they want to buy into them. And not buying into a thought can really help someone then take one step forward to moving in the direction of a value.
So maybe to make it tangible, I'm thinking of one of those examples, like if my values in life is curiosity, learning, education, something like that, but then maybe I'm not signing up for that class or whatever it might be because I don't want to experience the threat of failure. So then that's where willingness would come back in, because you would start to be willing to have the potential experience of failure, or to have the thought of what if I fail, or something like that. And then that might help you get over that obstacle towards action.
Yeah, absolutely. There's a lot of different examples. You can think of someone who maybe feels anxious in social settings, but really desires to be connected to others. And so you would use this willingness or acceptance point to be willing to open up to the experience of having that anxiety or having those thoughts, and diffusing from the thoughts like everyone's going to hate me, or I won't be able to carry a conversation. So being able to get some distance from those thoughts, recognize those just simply as thoughts, so that you can decide whether or not you want to take action and move forward and getting yourself out into a social situation, taking that committed action because perhaps you value being connected.
Right. That's another good example. Definitely. So I am looking at the time here and thinking that there's so many other things that we could talk about, but maybe this is as good a place as any to sort of start to wrap up a little bit.
Sure.
Yeah. So I'm wondering if our listeners are enjoying listening to you talk about the Hexaflex, or and if they want to connect with you in some way, if you have anywhere that people could find you that you might want them to know about or come find you at.
Yeah, absolutely. So I'm on Twitter. You can find me at Lindsey Jacobs. I also have a podcast called the Gero Psychology Podcast. So you can follow me on Twitter at the Gero Podcast, or come to thegeropsychologypodcast.com and leave me a message there.
Awesome. Great. So I will be putting that, as well as some of the things we talked about here, like that Russ Harris exercise, the values card sort, a picture of the Hexaflex diagram. I'll be putting all of that on the show notes.
Also, are there ACT resources that you would recommend for listeners?
Absolutely. There's a couple of really nice books.
One of my favorite ones is the Get Out of Your Mind and Into Your Life.
Yeah, and Act Made Simple by Russ Harris is a really great book as well.
Excellent. Good. So I'll also put those in the show notes too.
Great. Thank you so much, Lindsey.
Yeah, thank you so much.
Thanks for listening today. This podcast was brought to you by the Institute for Meditation and Psychotherapy, a nonprofit organization dedicated to the integration of mindfulness, meditation, and psychotherapy. For more information, visit meditationandpsychotherapy.org.